Today on Substance Stories, we're continuing our harm reduction series by talking about benzodiazepines. Today on Substance Stories, we're continuing our harm reduction advice series. So remember, harm reduction advice is advice about how to reduce harms from substance use. I'm not advocating for substance use, and the best way to reduce harm from substance use is to not take them at all. We are continuing our series, and today we are talking about benzodiazepines. Now, there's three main things to keep in mind if we're thinking about using illicit benzodiazepines. The first thing is that illicit benzodiazepines are of a shocking quality. So they are made to look like they're legitimate. They are produced in illegal factories that even print fake labels. But when we test them, they do not absolutely have anything that they're claiming they have in it. They're made in dodgy conditions, and even though they're claiming to have alprazolam, or what the street would call Xanax, they often have no alprazolam in there. They have atizolam, nor whatever modern benzodiazepine analogs there are out there. Some have been found to have fentanyl in them, which is a very easy way to accidentally overdose. So there is no reason why you can't take this sort of drugs to a testing facility to make sure you know exactly what you're having and you're not accidentally having something that is going to cause a significant amount of harm. The second thing to keep in mind is that these medications are incredibly well orally absorbed. Their bioavailability is close to 100%, right? It's about 95%. Which means that there is no reason to inject these drugs. You are getting as much of the drug if you eat it than if you inject it. But what you are getting if you inject it is an incredible risk load with that injection. You're putting yourself at risk of bloodborne viruses, of particulates that can cause nasty things in your lungs. You're putting yourself at risk of skin infections around your injection site and septicemia from that. So you're putting yourself at a lot of risk for very, very minimum gain. There is zero reason to inject these sort of medications. The third thing, and I think the most important thing when it comes to benzodiazepines, is these medications are incredibly easy to become physically dependent on. You take them for 4 weeks, you will have a physical dependence on it, and they're very hard to come off. And benzodiazepine withdrawal is deadly. So you have to really, really slowly come off these benzodiazepines. It's a very, very unpleasant thing. So if you were taking them daily for 4 weeks, you're putting yourself at significant risk. That's if they're prescribed or taken illicitly. If you take them daily at a significant enough dose, which is not that high, probably about 15 to 20 milligrams of diazepam a day for 3 months, you are putting yourself at serious risk of getting a thing called benzodiazepine-induced neurological dysfunction, or BIND. Essentially what BIND is it takes anything that the benzodiazepines were helping us with, anxiety, sleep, helping us, sort of feel more relaxed, and it reverses it. When we're in BIND, we feel more anxious. We feel we can't get to sleep with it. We can't get to sleep. We feel very confused. So they are causing significant harm after 3 months of daily use. And BIND, even if we do manage to get off the benzodiazepines, which is really hard if we're in BIND because we're so reliant on them, that benzodiazepine-induced neurological dysfunction can stick around for up to 2 years post complete cessation of benzodiazepines. So really, really, really avoid daily use of benzodiazepines. It is a terrible idea if they're prescribed or taken illicitly. Thank you very much.